Did you know this? You can look at someone and be completely wrong about their health. Here's a quick quiz before we begin. Can you tell who has herpes just by looking? Is there a permanent cure already available? And if someone has no symptoms, can they still pass it on? Think about your answers, we'll break them down clearly. Welcome to Easy Medics Daily, where we simplify medicine so you understand your body better. We thank God for life, for knowledge, and for the chance to replace fear with understanding. In this video, you'll learn what herpes myths get wrong, what science actually says, and how to think realistically about prevention. One of the most common beliefs is this: you can tell who has herpes by looking. It sounds simple, but it's not true. Herpes does not come with a permanent visible mark. Many people imagine obvious sores all the time, but that is not how the virus behaves. In reality, most of the time, there is nothing to see. Herpes is caused by the herpes simplex virus, and once it enters the body, it does not stay constantly active. Instead, it goes through phases. There are periods where symptoms appear, these are outbreaks, and then long periods where the virus is inactive or silent. Now here's the part most people don't understand: even when there are no symptoms, the virus can still be active on a microscopic level. This is called asymptomatic shedding. Think of it like a timeline. There may be a visible outbreak for a few days. Then weeks or even months of no visible signs. But somewhere within that silent period, the virus can briefly become active again without causing symptoms. During that short window, transmission is still possible. This is why relying on appearance alone is misleading. A person can look completely healthy and still carry the virus. At the same time, someone with a visible skin issue may not have herpes at all. Visual judgment is not diagnosis, testing is. Another major myth is about cure. You may have heard claims online saying herpes can be permanently cured with certain drugs, herbs, or treatments. These claims spread quickly because they offer certainty. But medicine requires evidence. Currently, there is no complete cure that removes the herpes virus from the body. Once infected, the virus remains in a dormant state within nerve cells. However, this does not mean there is no control. Antiviral medications are very effective at reducing outbreaks, lowering symptoms, and decreasing the risk of transmission. So instead of thinking in terms of cure or no cure, it's more accurate to think in terms of management. Many people live normal lives with herpes because the condition can be controlled. Now let's go back to prevention, because this is where clarity matters most. Prevention is not about guessing or relying on appearance. It is about understanding risk and reducing it. This includes open communication, proper testing when needed, and the use of protection. It also includes recognizing that zero risk is not always realistic, but lower risk is achievable. So let's revisit the questions from the beginning. Can you tell who has herpes just by looking? No. Can it be completely cured at the moment? No. Can it still be transmitted without symptoms? Yes. What matters is not fear,